Welcome back. From new lasers that stimulate collagen production to stem cell regenerative treatments that targets the areas of aging. These are some of the latest cosmetic beauty trends for 2025. Cosmetic dermatologist Dr. Jarrod Frank is here to tell us more. Happy New Year.
Thank you, Rosanna. Thanks for having me back.
Regenerative.
Let's do it.
What is that? Is that the word of 2025?
Well, it's a nice medical term for getting your body to do the work as opposed to using outside chemicals and things like that. So we have a lot of tricks to do that with stem cells, exosomes, newer treatments like V-cell, where we take PRP from your blood. We've heard of PRP for hair growth in joints, and we're able to activate stem cells in the blood using certain lasers and inject it back into you.
So is this different than PRP from years ago? Because I remember it was very hot for 1 minute.
It's PRP 2.0. That's what it is.
Does it work?
It does work, but it doesn't work for everybody, and you're not going to get a facelift-like result from it. But they're natural, subtle, and slowly progressive treatments, and I think people are looking for more natural now.
Interesting. So is it expensive? Are there any risks involved?
There's always costs. It's very safe because you're using stuff that comes from your own blood, and people really like that. There are no allergic reactions. The question is, are you a right candidate? You know, if you've never done anything and you have a lot of wrinkles, one PRP shot or V-cell shot's not going to do it for you. So it's about being the right candidate.
Does it go all over the face? How does it work?
You can inject it into the face, microneedle it. We use it a lot for hair growth. People who lose hair, perimenopause, that's where it works great. They're using it a lot in joints and other forms of healing where you need tissue repair.
Huh. Okay. Tell me something else that's a new trend from this year.
People are looking, you know, injectables are great. They've been around for 20 years. As we know, they've been a little overdone for the last decade or two.
Really? I wouldn't know what you're talking about.
You know, the best work is always the work you don't notice. So people are looking for new treatments that are non-injectable. And the Miria, which is a new type of fractional laser, tightens skin, builds volume, and, you know, kind of gives a natural look with a laser rather than injectables.
Do you see like a before and after? Do you see a real difference in using this?
You do, but it's not like a 1 week later wow type of thing. It's slowly progressive, and people aren't afraid of that anymore.
And how many treatments do you need to see a little bit? I'm looking at the before and after here. How many treatments do you need to see a little bit of a difference?
If you're younger, in your 40s, one treatment. If you have severe acne scars and are older, you'll want 3 or 4. But I think it naturally regenerates treatment, so it's something that people are going to do some sort of maintenance for going down the line, like once a year.
Is it an investment?
It is always an investment. Listen, everything takes maintenance, right?
Right.
Even a facelift takes maintenance that lasts 10 years or something like that. As long as we're living, we're aging.
And the risk, any risks involved with this kind of laser?
Always risks, which is why it's most important that you see a healthcare provider that recognizes a good candidate and uses the technology appropriate, because you are burning or resurfacing skin. So it's a matter of tricking the body to get it to do what we want it to do.
So Dr. Frank, what I have noticed, and maybe you can jump on this or tell me I'm wrong, you know, it used to be that everybody wanted to look like the Kardashians. But now I feel like there's a trend toward looking more natural. For example, Lindsay Lohan. Did she do something?
Well, I'm not her doctor, but I would say, listen, I think in regards to the Kardashian, that look of like wearing your features like the letters on your bag, like things that stand out, I think people are looking to more conservative things. And people have abused the non-invasive treatments that I do. Too many injectables, too many devices, too many things. I think people are not afraid of surgery anymore. They're willing to do the one and done. It's more socially acceptable. And I think someone like Lindsay Lohan, is probably taking much better care of herself. I think she has a child now. She's older. So it starts from within. Stop drinking, stop doing other things, and not laying in the sun. And maybe she did a surgery, which when done right can be natural and safe and acceptable.
So I know that you're not her doctor, and a lot of doctors are guessing that maybe she had some kind of facelift, right? She's young for a facelift, no?
You know, it's not an age thing. It's about what you don't want to do is see someone abuse the non-invasive treatments, which are great up to a certain point, but there's a point where you have to say either self-acceptance or taking a more aggressive step. And for her, maybe her skin type or the way she took care of herself for a while, this was maybe time for her.
Okay, she looks fabulous, by the way. CO2
lasers, another example of like the one and done. That's like the facelift of laser surgery. It's been around a long time. It works great. And I find that people are more accepting of doing the one and done procedures, because although the non-invasive things work, the other lasers, the injections, there's a lot of maintenance. Right. And there's a law of diminishing returns over time where people are just kind of like, you want to do what you want to do, and I think we're overall much more accepting of these more aggressive procedures.
And what about something called micro-coring?
Micro-coring. So I think the holy grail of what I do in cosmetic dermatology is a way to remove skin scarlessly without cutting, like the facelift. And this technology, Elocore micro-coring technology, is able to remove little bits of skin where the tissue closes without scars. So it's the first technology of its kind where we could remove little bits of jowls or loose skin or fine lines and wrinkles without having to do a facelift.
Do you do it in the doctor's office or do you do it in a hospital?
Do it in a doctor's office. We inject local anesthesia, very similar to like a dental procedure. Now again, we're not doing elderly people with hanging jowls, but early stages people in their early 40s, late 40s who have little bits is a great preemptive way to put off surgery or to avoid it.
Wow. All right, Dr. Frank, how can people find you?
Oh, P. Frank MD or at Dr. Paul Jarrod Frank on Instagram.
All right, now I know what I have to put on my list for
That's
2025.
right. Thanks so much,
Thank you. Good Day's coming right back.